Dr. Sharath from DRM Multispeciality Hospitals, consultant pediatrician and neonatologist. I am here to talk about today's theme, that is 24th of March 2022, World TB Day. This year's theme is Invest to End TB and Save Lives. So what does this mean? That it means that we have to invest all of our resources to end this TB as a disease and save more lives. Why we have taken these resources this year is because of the COVID-19 pandemic, which has increased the burden of tuberculosis in the last 1 to 2 years. Till 2019, we had achieved tremendous success in reducing the burden of tuberculosis. But because of pandemic and because of poor drug distribution and poor patient compliance and increased restrictions, we are not able to dispense drugs, we are not able to do the diagnostics for the TB and increase the TB burden by more than 20%. In the last 1 year, we have seen 1 lakh diagnosed cases of TB in children. So as a child doctor and a pediatrician, I urge everyone to think and invest more in removing this burden as a whole. So what is the burden? As I said, last 1 year has clocked 1 lakh pediatric TB cases diagnosed in whole of our country. And how different is this from our pediatric TB from adult TB? Pediatric TB is different than adult TB in many ways. First of all, as we know, TB doesn't affect only lungs, it also affects all the other organs, especially abdomen, spine, brain. So these things are difficult to identify in children and we often miss the diagnosis. So any child with poor nutrition, not able to put on weight even after good nutrition, or child is lethargic, generalized weak, so we have to consider TB as an option. So what are the treatment modalities? Treatment is more or less same than adults. We have to give all the drugs which are available readily by the government of India as well as private sectors with proper dosing to the children, which accounts for 6 months of treatment. For that, we have to diagnose TB, we have to diagnose the type of TB and then start the treatment. Treatment is completely free of cost in so many government centers, and diagnostics has been set up in a whole of country in such a way that diagnosis is not going to miss out. It can be done in many good labs and labs set up by the government sectors. How is this TB can be prevented? TB is one of the drugs which can be prevented very effectively by giving one vaccine called BCG for the children after birth, preferably in 24 hours. BCG should be and must be given to all the babies who are born, and it's a duty of the pediatrician to ensure that the baby is receiving the BCG vaccine. Despite giving BCG, the baby must be kept isolated if the home or the place contains any active TB cases, and anyway we have started using masks, so we have to continue using masks in all the places where we find active TB cases. So on this day we have to fight TB by investing more of our resources, time and diagnostics in ensuring that pediatric TB population drastically comes down. Thank you.